Hello, everyone, and welcome to this audio podcast. This audio podcast is part of the laboratory inquiry. This audio podcast is part of a Helm and BackRow. This audio podcast is part of a Helm and Rudder. This audio podcast as part of a Storm Robotics production. In this audio podcast, I'm now looking at sort of the sort of overall sort of discussion aspects as part of this peer-reviewed and published works from 2023. So whilst there was some overlap relating or regarding themes and inductive content analysis, the research has had highlighted online spaces can be used inventively to help highlight how patient and public involvement or healthcare service user involvement, for example, healthcare service user involvement can also play a role in developing educational support through healthcare systems. All CKD all healthcare service user or CKD participants were in between CKD stages 4 and 5. Telephone interviews were short, but allowed participants to put forward views and understanding relating to educational needs and patient care. Using an ICA approach had helped gain an understanding of the inquiry or the research sort of question and healthcare requirements specific to healthcare service users or CKD sufferers. So access to allied health professionals or AHPs through online spaces could also provide patients or healthcare service users with educational supports, improving quality, experience, and evidence-based practices, um, men, um, mentoring, training, and patients sharing or healthcare service users sharing experience should be about inclusivity and empowerment. Patients and families will also require educational support surrounding guidance on self-care. Access to AHPs or allied health professionals through online space could also provide patients with educational support, uh, improving improving the quality experience and in around again the evidence-based practices. So by 2030, if not before, AHPs or allied health professionals can perhaps expect to be better integrated into pathways, working through online spaces and through sort of group consultations. Having access to a network of AHPs prompts healthcare service users to be more included in aspects of healthcare, thus increasing practical understanding of disease. Understanding thus increasing the practical understanding of disease and treatments, and overcoming educational barriers and addressing possible healthcare inequalities. Peer-to-peer interactions can be used to educate and empower healthcare service users or patients, but alone it is inadequate and imperfect. Whilst there is some novel educational projects and sort of propositions and works taking place, joined up thinking would prompt a smaller working sort of relationship or a relationship across professions to drive an all-encompassing approach to healthcare service users or sort of approach to healthcare service users or CKD to chronic kidney disease and and sort of broader care pathways to convey better outcomes for patients or healthcare service users prospectively. There is scope for service development and initiatives relating or regarding patient care through online education and peer support, but there needs to be a coordinated effort between healthcare service users and healthcare providers to be a coordinated effort between uh, uh, sorry there is a need for a coordinated effort between healthcare service users and healthcare service providers to understand how and where inclusion can be improved, including online and social media platforms for healthcare education provision. That draws this audio podcast to a close. This audio podcast as part of a laboratory inquiry. This audio podcast as part of a Helm and BackRow. This audio podcast as part of a Helm and Rudder. This audio podcast as part of a Storm Robotics production.